Good afternoon, dear patients. Today we will discuss the topic of itching in the pubic area. A patient came to see me with itching in the pubic area who had noticed red spots on his pubic region. He would periodically apply various glucocorticosteroid ointments to these spots, as prescribed by doctors among others. However, for the past several months, he probably hasn't visited any doctors. After hormonal ointments were prescribed to him at the dermatology dispensary, he continued to apply them from time to time. However, despite these applications, the itching often did not go away. Sometimes there was even a burning sensation in the pubic area. Upon careful examination, there were indeed areas of redness, red spots visible in the pubic region. Along with the red spots, we also noted the presence of blisters with clear fluid as well as with purulent contents. Sometimes there were small blisters which were often grouped together. And of course, all of this was against the background of red spots, as you can see in our illustrations. Accordingly, the patient was first tested for allergies. At the dermatology clinic, of course, these tests were not performed. Dermatitis was diagnosed just by visual inspection. You can find more detailed information about allergy testing in a separate video on our channel. In short, these include immunoglobulin E, a complete blood count, circulating immune complexes, eosinophilic cationic protein, and so on. Next, samples were taken from the surface of the rashes to test for herpes viruses of various types. At the very least, tests were conducted for herpes simplex virus types 1 and 2, as well as for shingles or herpes zoster. This is a PCR test, a scraping taken from the surface of the rashes. As a result, elevated levels of immunoglobulin E, the main substance involved in allergies, were found, as well as increased levels of eosinophils, the primary cells involved in allergic reactions. And accordingly, in addition to this, positive PCR test results for herpes simplex virus type 2 or genital herpes were obtained from the surface of the rashes. Fortunately, these rashes were not located directly on the penis, which would have caused this man much greater suffering, but rather on the pubic area. Accordingly, an immunogram and a general analysis were prescribed first of all. A complete blood count was performed, yes? An immunogram was ordered, although it should be noted here that unfortunately the immunogram process only begins with a complete blood count, so it was repeated for this patient. What was prescribed? Step-by-step therapy. To start, sodium sulfate, calcium gluconate, and antihistamines were prescribed. And accordingly, antiviral drugs were also prescribed, for now in the form of oral medications such as Valvir and Valtrex. Later on, there was a noticeable improvement. Why? Because, well, it turned out from the start that there were actually two diseases. It was a combination of genital herpes, which, by the way, I forgot to mention, blood was also taken for this, and positive IgM immunoglobulins were found, which indicates the activity of the process in this case, though probably not a recent infection. And also, accordingly, a combination with an allergy. If we eliminate one of the factors, things already become significantly better. Subsequently, the patient was referred to an immunologist, where immunocorrection was carried out according to the immunogram. You can also watch a separate video on our channel for more details about herpes treatment, so we won't go into that now. The takeaway from this video is that quite often doctors or even patients themselves prescribe hormonal ointments without any tests. Even if you are diagnosing an allergic reaction without considering herpes or anything else, you should at least do the minimum tests for this allergy. Whether it is present in your blood or not, whether you need any systemic treatment, whether you require additional testing for food intolerance or other allergy tests, these are things you need to determine. The use of ointment, especially if it hasn't helped after, say, 7 to 10 days, definitely requires consulting a doctor and undergoing a more thorough examination. Unfortunately, many dermatology patients do not understand this. Or when they start to feel a little better, they stop all treatment, forget about it, and continue to suffer, further making the condition chronic in their bodies.